Hello everyone, we're back, and this one's going to be a pretty short one. After looking at Alzheimer's disease and seizures, we wouldn't be thorough if we didn't talk about some of the medications or treatments actually, because strokes can be caused from a numerous of other chronic conditions. So it would be depending on what the patient needs and how they're responding and how they got the stroke and what type of stroke it is. So CVA is cerebral vascular accident, which we talked about in the patho of neuro. Is ischemic treatment only. It's only for ischemic strokes, meaning where there's a blood clot. We have a drug that was only, they came up with this treatment not too long ago, and then the hospitals became what we call stroke certified, and we are very fortunate in this county have several that are stroke certified. And it's called TPA, and it is the gold standard. It's the only FDA approved treatment for ischemic strokes, and it's referred to as tissue plasminogen activator. Obviously, that's why they call it TPA. Also known as IV RTPA, it's given through an IV in the arm only, and it can be given into a vein or an artery. So how cool is that? It works by dissolving the clot and improving blood flow to the part of the brain being deprived of blood flow. So basically, this is the only treatment that they have found so far that can actually reverse a stroke. And so the patient, we can save the patient from brain damage and therefore not being paralyzed. They can't talk, they can't swallow, all the things that go along with a stroke. But, and there's a big but, it needs to be administered within 3 hours. They used to say 4 to 6, now they're saying 3, and up to 4.5 hours in certain eligible patients. TPA can improve the chances of recovering from a stroke. They say any time after that, it's not going to work. It can actually kill the person because of what it just is such a strong medication in trying to ream that clot off, break it down, bust it up, and get rid of it. A significant number of stroke victims don't get to the hospital in time for TPA treatment because sometimes they just wake up with it. So basically they say this needs to be a witness stroke. If it's a witness stroke, you need to get them to a stroke center as soon as possible. And when you're calling 911, you need to say, I think I have a stroke victim here. This is why it's so important to identify a stroke immediately. And then we'll talk about drugs for multiple sclerosis, another autoimmune disease that we really can't cure, but we can help manage. They have disease-modifying therapy, decrease the frequency and severity of relapses. It reduces development of brain lesions, decreases future disability, obviously, if you're going to reduce the development of the lesions, and help maintain the quality of life, which is what we're all about, right? So we have our immunomodulators and our immunosuppressants for MS. Immunomodulators, interferon beta, glatiramer acetate, whatever that is, natalizumab, and fingolimod. They're all immunomodulators, and they're believed to work by inhibiting the migration of the pro-inflammatory leukocytes across the blood-brain barrier. I'm going to say it again. Inhibiting the migration of pro-inflammatory leukocytes across the blood-brain barrier, thereby preventing these cells from reaching neurons of the central nervous system. And secondly, our immunomodulators, because again, it's modulating that immune system that we have. It suppresses the T helper cell activity because, like in many autoimmune diseases, we don't know why our immune system is kicking it up or acting the way it is. And that's why we don't understand it. Okay, and then immunosuppressants, same thing. We want to suppress it. Minoxidil was first developed to treat cancer, and I actually have used it in the 80s to treat cancer, but then it was approved for multiple sclerosis. It poses risk for toxicity to bone marrow depression, cardiotoxicity, fetal harm, and again, if we know that it was used to treat cancer, we know there's probably going to be a potential to diminish the bone marrow. It's, again, immunosuppressants are like cancer-fighting meds. They're toxic to all cells. So with this disease, it's going to suppress the production of the immune cells, the B lymphocytes, the T lymphocytes, macrophages, and thereby decreases the autoimmune destruction of myelin. And that's what we know is happening with multiple sclerosis. But you can also see why it's very dangerous. And I think that's all I have. So So not too bad for our medications for our neuro diseases. All right, until next time, take care.